everybody. We're doing our little educational videos. I'm Dr. Angelina with Surgicare Arts and Ideal Body Institute with my offices in Loganville, Georgia, and soon to be open my Buckhead office, which is going to be awesome, in Atlanta. Today we want to talk about lip fillers. We're running a special this month where if somebody's getting breast surgery, they can get 1 syringe of fillers for their lips for free. So it's a great promo. And so we had some questions about that. And we're going to answer them. So we're going to start off with a weird one. Can I remove my fillers once I get them? Depends on the filler. The ones that I use, yes. So I use hyaluronic acid fillers. For the lips, usually we use Juvederm products. So either Juvederm Ultra Plus, Ultra, Volbella, Volure, all of the great fillers. We customize it to the patient. So it depends what you're trying to achieve, what kind of look you're going for. We can vary the fillers. So those type of fillers are dissolvable. I have a special product and I can dissolve hyaluronic acid filler. There are some fillers out there which are really not meant for the lips that are not dissolvable, but again, I don't use them. What type of filler should I get? So again, I said there are several types of fillers that we have, even within the Juvederm family, and it will depend on what you're trying to achieve. Some people just like to get kind of a hydrated look, just a little touch up to plump up the lip, and we can use Volbella for it. Very natural, almost nobody can tell you had it done except you, hydrated, fresh. Some people want to, again, they have the volume, they have the lip, but they want it just a little plumper, maybe a little bit more, slightly more noticeable, maybe outline the lip a little better. So Volure is very good for that. Then Juvederm, the original Juvederm products, Ultra and Ultra Plus, they're great, but they're also great to build up the lip, to make the lip a little bigger. If you have very thin lips, almost no lip, especially when you smile, those are the products I would probably start with. What will it look like on me? Well, it depends on your original shape. You know, we have to work with what you have, and also depends how many fillers we're going to put in. You know, somebody with very thin lips may need to have several syringes of filler, and that's what we go by. So it's really an individualized kind of thing. Are there any risks? There's always a risk. If you go to an appropriate professional, somebody who knows what they're doing, your risk is minimized. Mostly we get, most common complaints are swelling, sometimes some bruising. And with certain products, like Ultra Plus, some people will notice or may get little nodules, which eventually go away, and we can deal with them. But the true risks is if you somehow occlude a blood vessel. We have a lot of blood vessels in our lips, in our face, and if the filler goes in there, it can actually cause real problem. Ischemia, meaning not enough blood flow going somewhere. Easiest way to remember, imagine that if you put a rubber band on your finger real tight for a real long time, it's going to turn white and blue, and that can happen to your face if you're going somewhere where they're not necessarily, if they don't know what they're doing. But can happen to anybody. Again, have to minimize your risk. How much does it cost? Depends on the filler, depends how many syringes we're getting. In my practice, we charge per syringe. Other practices out there may charge per session. So that's something we actually post online, and we have a menu with all the pricing that you can pick up and see what our prices are. How big will my lips get? Again, depends how many syringes we put in there. And we can, usually I would inject the filler, and as I go, I'll ask you with the mirror, do you like what you're seeing? Is this enough? You want to go bigger? Of course, everybody is different. Everybody has different preferences. How long do they last? Again, depends on the filler, but I expect at least a year, sometimes a little longer on certain products. Also depends how much you use your lips. How do I prepare for my appointment? Well, I prefer when you come in, you don't wear makeup. I would like for my patients not to take any blood thinners, aspirin, Plavix, ibuprofen, goody powders, lots of alcohol before you come in. Also, turmeric goes into the same category and some of the vitamin E's. So best, you know, to talk to me and we can really make sure that you're not taking anything that will increase bruising. Will I have numbing? Yes, you will if you absolutely want to. Most of my patients get numbing. We'll put cream, we'll wait for a few minutes, make sure it's really numbed up. Sometimes we'll even put a little ice to, you know, ice it up a little bit to really minimize discomfort. Does it hurt? Usually once you're numb, it doesn't really hurt. Can I just get one lip injected? I guess you could. It's a possibility if you're really trying to correct maybe some irregularity. We can do whatever you like, but I like to even things out and make sure that we are aesthetically pleasing and not making you look funny or ducky. Will I bruise or bleed? I kind of talked about it already. Yes, if you drink a lot of alcohol the night before, you may bruise or bleed, but generally no. Downtime, no real downtime. Obviously, I would not do it if you have some function or photo shoot the next day. You probably want to do it a couple weeks before any major event. But there may be some swelling for a couple of days. So, and again, if bruising happens, you definitely, again, no downtime, nothing you cannot cover up with makeup, but there definitely could be some changes. Can I exercise? Yes, you can exercise. Will it feel weird? Well, first, a little bit is gonna feel weird because it's numb, and numbing makes it feel weird, not the filler. Will I have lumps or bumps? Depends on the filler. There are a couple older fillers that may cause lumps and bumps, but generally we try to avoid them by the way we inject, so the technique matters. Will they migrate or move? If you mess with them enough in the very beginning, you could potentially move them around, but I ask you not to do that. And are they permanent? No, they're not. They are dissolvable. They are absorbable, meaning your body will absorb it within at least 18 months. If you guys have any questions, come and see us at Surgicare Arts, main location, our surgery center and facility in Loganville right now. Hopefully in a month, we'll have a grand opening. Of course, it's going to be posted everywhere in Buckhead on 371 Paces Ferry. Our phone number is 678-304-0628. And of course, I'm on Instagram, Facebook, and Google, and YouTube, and all of that. Find me. Come see me. Thank you all.